She said the moment the door closed behind her when she walked out of the clinic, she knew she'd made the wrong decision. And so she drove home and frantically Googled, can I reverse my abortion? And that's how she found out about the APR network.
It's really almost a miracle that we are able to offer this to women when they do have regrets about taking that pill.
It was an easy 2-minute phone call talking to this patient and then calling her pharmacy to prescribe the medication. And so fulfilling realizing that I helped to save a life.
My name is Christina Francis, and I am a board-certified practicing OBGYN in Northeastern Indiana.
I'm Dr. Carice Trandom. I'm an obstetrician and gynecologic surgeon.
My name is Dr. Catherine Stark. I'm an OBGYN physician from Rochester Hills, Michigan.
I have helped women with abortion pill reversal for the last 7 years.
I've been working with the Abortion Pill Reversal Network for about 2.5, almost 3 years now.
When I first heard about abortion pill reversal, I was amazed and also so excited because in my practice, I had talked to countless women who had made an abortion decision in the past and then regretted it. So the chance to have something that I could offer them to potentially prevent that regret was really exciting to me.
When I quickly read about the protocol, I realized it was a very simple, very straightforward medication, easier than most of my prescriptions that I prescribe. And so now being able to prescribe it, it's a piece of cake, and it results in life for my patient and for her unborn baby.
So abortion pill reversal works by trying to block the effect of the first medication in a medication abortion. So when a woman goes to get a medication abortion, she's given 2 different medications. The first one is called Mifeprex, and the second one is called Misoprostol.
And it blocks progesterone, which is a necessary hormone to support the developing fetus. This mifepristone blocks the development of the placenta, thereby depriving the developing baby of nutrition and oxygen, necessary nutrients, so it can continue to grow. Without those nutrients, the baby will slowly die.
If a woman has taken the first medication and then changes her mind before taking the second medication, then we can give her large doses of progesterone to try and displace the first medication from the receptors and to try and block the effects of any further action from that medication. And in doing so, then we can lead to having a normal, successful pregnancy. And that happens about 70% of the time.
Out of the blue, the thought struck me from nowhere, like, you've been saying this for a long time that you're going to do this, and you keep putting it off. You need to do this now. So I, right there, got on my laptop, went to APR Network. I sent an email to the person in charge and said, I'd like to volunteer for the APR Network. What do I need to do? What do I need to know? And the next morning, I got an answer back with the application, all the information I needed. I had to fill it out. They checked me out. They said, sure, you can be part of our network. And the next day, they sent me, again, all the materials that I needed. During my lunch hour that Wednesday, I put the protocols all together and wrote it out in a simple manner and put it up on my bulletin board right in front of my desk at work. So I knew where I would go, what I would look for when I got a call, if I ever got a call, and I didn't know if I ever would. So I start my afternoon, I go in the very first patient, 1 o'clock patient, and I walk in the room and I sit down with her and I said, how can I help you? I'm Dr. Stark, what can I do to help you? And she starts bawling and she says, I took the abortion pill and I want to reverse it. So I helped her. And we were able to get an ultrasound that day. She had a heartbeat. She still had a viable baby, and we saved that baby. It's really almost a miracle that we are able to offer this to women when they do have regrets about taking that pill.
I had a patient who was just a beautiful woman who became pregnant from a one-night stand and a gentleman she didn't really have his phone number or know anything about, and she felt like she needed to have an abortion. She had taken the abortion pill from another provider, and she was in tears and saying, "Dr. Trandum, please, please stop this, please stop this." So I was able to administer the medicine right there. We have it in our clinic, and then follow her throughout her first trimester, showing her baby growing healthily as a result of taking the progesterone.
From a professional standpoint, so fulfilling to just know. I mean, oftentimes in medicine, yes, we're in the practice of saving lives and things like that, but I don't know that you ever get to see it quite so tangibly as you do when you do abortion pill reversal and you know that that baby was destined for certain death and you were able to intervene with the miracle of modern medicine and save that life.
When I first started doing this work with the APR network, I was amazed at how often clients would call the Heartbeat International hotline in a panic. And it comes to the point that they admit to us that they were pressured by family, mostly by boyfriends or partners or husbands. But as soon as they took that pill, they just felt an immense sense of regret and wanted to do whatever they could.
But the amazing thing is that I've now consistently had several women use almost the exact same words, that it was like they were walking around in a fog, and as soon as they took that first pill, the fog was lifted and they realized almost immediately that they made a mistake. And so I think for many women who find the APR network when they call, it's such a relief.
It is oftentimes the most determined woman who's determined to have an abortion who will then immediately change her mind and ask for a way to reverse that solution. And so we make sure in our pregnancy resource clinics to tell all of our patients who are determined and leave our doors still determined to have an abortion that there is a solution to reverse the abortion pill.
I think it's important that we get more doctors involved in the abortion pill reversal network to offer this to more women, as there are many, many women who are ambivalent about having an abortion. Many are pressured into having an abortion. And many of these women don't know that there's an antidote to the abortion pill.
As a physician, I understand what it's like to be very busy during the day, but the abortion pill reversal is not a huge time suck or requires significant thinking or taking on risk. It's an easy prescription and an easy follow-up, and everyone should be aware of this tool, whether they are pro-choice or pro-life.
And so as a woman and as a physician, I want women to be empowered with information, with all of the information that we have, so that they can receive excellent health care, so that they can receive the best thing for them at that moment in their life, and that they can receive the support that they so greatly deserve.
This has been an acceptable off-label use of natural progesterone for a long time in this country. There are several large studies supporting its use in early pregnancy with no safety concerns whatsoever. So it really comes down to, is this in your heart to do this to help women? And if it is, you belong with us.